Okay, I'm going to be doing the pelvic exam and PAP. So here is my client here, this pelvis, and we already went through the informed consent and I explained the procedure to them, and I just stepped out so they could get undressed from the waist down and put the drape over them. So I come back in, and I wash and dry my hands. And they also went to the bathroom while they were before they got settled. Excuse me. So I get all my supplies all set up here, which is my sterile field and my cyto brush and my solution and the speculum, my sterile gloves, and my lubricant jelly. So I have all that set up, and I have a handy headlamp, although the light in here is really good as well. And so I first am going to put on my sterile gloves, don those on both hands, and let the client know that I'm going to touch them and first touch their thigh, and I'm observing the external genitalia, so looking at any just the hair pattern and any kind of abnormalities, discharge or color, hair growth, anything that I can see kind of initially. And then I tell them that I'm going to, you'll feel my touch, I'm going to just gently spread your labia, and I will do that. And I will look now here at the vulva again for the same things, just assessing any abnormalities. And then I tell them that I am going to use the speculum to insert to be able to see. So I guess I should have put lubricant on that before I got my fingers ready. So I'll put lubricant just on the sides of it, making sure to not get too much on the inside. So once that's already in and my fingers are here, and I can have the option of letting them insert the speculum themselves, which I'd never seen, but I liked that idea that Delandra gave us. But for this purpose, they wanted me to do it, so I insert it horizontally or kind of vertically, and I just let them know you're going to feel the speculum. I'm just going to go in nice and slow, and then once we get to where we're going here, I'm going to rotate it. Good. And open it, and I'm doing it like this because the chair's in the way here, but I think that, so you can see that, perfect. Okay, and so now I am doing a visual inspection. I'm making sure I can see the cervix in the tunnel there. We're just going to assume that it's right there and easy to see. I'm checking for, again, discharge, any kind of like friability of the tissue, redness, any lesions, any swelling or any kind of scars. And everything looks great, so I'm going to go ahead and get to the sample. So I have this cyto broom, and I'm going to insert it in. So I'm just going to let the client know, is that okay? I'm going to insert this in to get a sample of your cervix. So I'm going to go right in there, and I'm going to put the longer bristles on the inside of the os, endocervical, and the shorter ones going on the outside of the os, and I'm going to rotate it 5 times to get a nice sample. And then I'm going to draw that out. I'm going to have my assistant open the solution, which is right here, and I'm going to put that in there. And this particular one you can pop off, so I'd pop that off. And my assistant would close it. And I would tell them that everything looks great, and I'm going to now remove the speculum. I'm just going to do that slowly. Before I do that, I could ask if they would like to see their cervix with a mirror, and I could hold the mirror out if they'd like to, or take a picture with their phone if they're curious about seeing their cervix. And then I will let them know I'm going to take it out. And so I make sure to close back and to be careful not to pinch them. And I turn it again kind of diagonal to take it out. I come out slowly, being sensitive to the client. Great. Okay, everything was great there. And if you're comfortable still, you can just stay in that position. I'll set this down over here. And I'd like to do just a little internal exam with my fingers to check for your cervix and kind of how it feels, and your uterus and your ovaries. Is that okay if I palpate inside? Okay, so I would change my sterile gloves because now they've been a little bit contaminated, just to make sure I don't introduce any bacteria into the vagina. And again, I tell them, okay, you're going to feel my touch. I'm coming here on your outside of your thigh. Great, and now I'm going to separate your labia. Good, and I'm going to just put my fingers on the inside of your vagina. Okay, does that feel okay? Okay, great. Again, I'm just assessing as I go, looking at the tissue, the tone, again, checking for any lesions or if there's any tenderness. And then I come inside a little bit more, 2 to 4 centimeters, and I can palpate for the Bartholin's glands at 3 and 9 o'clock. And then go all the way back to the cervix, and I can feel the length, the position. If it's, forward or back, it's forward now. We know that because we just did the speculum exam. And I can check for effacement, dilation, just the general kind of placement of it, and if there's any tenderness there on the cervix. And then I put my fingers below the cervix. And I'm going to bring my other hand just to your uterus. Is that okay? So I'm feeling in between my fingers and the tissue now, which is the uterus, and I'm just checking the uterus for swelling and tension and any kind of abnormalities. And then I'm going to go bring my fingers to the side of the cervix, the side of the uterus. I'm assessing your ovaries now, feeling for inflammation, any kind of masses or tumors or anything on any of the external anatomy. Feel both sides. Okay, great. Everything feels good. And I'm just going to slowly remove my fingers almost all the way. And then can you just tighten your pelvic floor muscles around my fingers, just checking for your pelvic floor function. Okay, that feels great. Okay, I'm going to slide my fingers out. All right. And I'm going to take off my gloves. Let the client know you can slowly get up. I can help you get up. You're all finished with the exam. Thank you so much. Everything looks great. And we will send this PAP off to the lab. And I would explain any other findings if there's anything else notable. And then I would document all of that.